Hello, everybody. I am going to tell you a little bit about the public health professional that I interviewed for this assignment. Um, the person that I interviewed was Mallory Danford. Now, I know she's very new to the public health profession and isn't quite finished with her degree, but I've been following her for my practicum, and I have felt that she has taught me so much about what it means to integrate public health into medicine that she was just a wealth of information that I felt that I should interview her and ask her a little bit more deeper questions about how she feels about her job and specifically what more how she feels that she's integrating public health into medicine, since that is my particular um, niche within public health that I enjoy very much. So, Mallory works at Sanford Health in Fargo, and she's the ambulatory clinical quality coordinator. And she's been in that position for about 10 months. As the ambulatory clinical quality coordinator, she manages quality measures for the FM area clinics and the 50 plus other clinics throughout the upper Midwest. So clinics all the way out to Bismarck, and then clinics all the way over to Bemidji, Minnesota. And there's clinics scattered all throughout there that she's managing their data, we could say, to ensure that they're offering the best quality possible. She also works with principal investigators to efforts to improve the quality of care. So she's constantly looking at initiatives and changes to ensure that they're working and moving their quality scores in the direction that they need them to in order to meet the national measures to get reimbursed from Medicare, Medicaid, and Blue Cross Blue Shield. For those of you that don't know, quality in healthcare has become a very big thing with the Affordable Care Act, and they there's a thing called meaningful use, using the data that they collect on medical records in order to look at and measure how healthcare providers are performing, and even at a broader aspect, how hospitals and clinical facilities are performing. For example, one of a measure would be like what I'm working on colorectal cancer screening rates. We would like to see that 80% of all people that are eligible for a colorectal cancer screening is being screened by 2018. So there are constant efforts working to ensure that we're going to be reaching that 80 by 18 goal. Then she also contributes to Sanford's health efforts to improve population health, which ties into all of the efforts by the entire enterprise to meet these measures, improve their quality, make sure that people are getting preventative care that they need, so on and so forth. So she reports to the director of quality and patient safety, who is Patrick Schultz, which some of you may know from the public health professional panel that we had during Public Health Week. I believe that was Public Health Week. Anyway, he's an amazing man. I've learned a lot from him too. He's very proactive and loves where healthcare is going, and he really has a passion for his job. So Mallory helps Patrick by monitoring clinic quality. So Patrick oversees hospital, clinic, patient safety, like all of that. So Mallory specifically focuses on clinic so that he doesn't have to do all the groundwork when it comes to the clinics. Then she also helps him by ensuring that clinics are ready for a Joint Commission survey, which, for those of you that don't know who Joint Commission is, it's an accreditation agency that a lot of reimbursement is tied to. So many places, although it's a volunteer survey, a lot of money is on the line for Joint Commission, and it's just a status thing, ensuring that your healthcare is the best healthcare that you can be providing. She also leads and assists with projects that are going on in clinics. So Mallory kind of works from the mothership in Fargo, and then helps out with resources to all the other clinics that are throughout the region. And then she also performs audits on clinic performances, which she's just constantly looking at charts and ensuring that numbers are moving in the direction that they need to. Also, I forgot to mention that no one reports to Mallory specifically, but with helping the clinics with projects and doing their audits and always working with them, she acts as kind of a liaison for the clinics. Like, she's in constant communication. She's got a good relationship with them, and always helping them whenever they need help. And she's been a great resource for these clinics, and I've learned that, it may not be what you know, but it's having that relationship with those people and helping them figure out what they need to know in order to do their job. So the ups and downs of the job, she said that the rewards of her job is providing the tools to help improve patient care. She said it was very rewarding to be able to help these clinics get the information that they need or the help that they need. And then seeing the results of their quality scores moving up is very rewarding in her job. The downfalls, as we all know, are learned in Dr. Strand's class with Epi, that data discrepancies, learning that, or it's frustrating for her when she gets back reports and they're not reporting exactly how she wants them to, or people aren't putting in the data right, or it's just not a good measure. So we always have to be very cautious when working with data. And she said that can be very frustrating at times because it could not be it might, even though that it's required to be reported on, it may not be an accurate measure of what's actually going on. And then she also said that things that keep her up at night is, she said that not meeting quality goals is a huge thing that would keep her up at night, because there's so much money on the line for these hospitals, that if you don't meet that goal, you're not going to get that money, and that could mean not being able to provide a service, or not being able to get that extra doctor or nurse to cover that, stuff like that. So she's always looking at what steps can be taken to improve, to ensure that we can always meet those quality goals. All right, so I asked her why did she choose the public health profession, and she said that she loves making change at the population level. And I have that same reason for joining public health. It's just, you're not just affecting one person, you're affecting the entire community. So then I asked her, did her education actually help with this movement? And she said yes, it really has. Work with just the idea of working at a systems level instead of a smaller individual level has been a huge help. Learning how to think, if I do this, if I do A, how is it going to affect B at a larger level? Anyway, also being analytical, and how to interpret data, I meant. She said that has been a huge thing for her, because before she would have just looked at it and taken exactly what it said on the page for a percentage to be correct. But now she's like a little more hesitant about doing that, looking into what goes into that data, how accurate is it, so on and so forth.